I went to the oncologist and I have notes. 5 pages again of notes, to be exact. I'm going to be looking over here because my notes are over here. I went to the oncologist. She did a breast exam just to check, I guess, to see if there were any more lumps in there, if the lumps that existed, if they got bigger. I don't know. But I never even felt a lump in there. So she went over my genetic testing results with me. Why is this like this? Brianna's all liking and commenting on my stuff. Anyways, let's get into it. She talked about my genetic testing results. She told me that it was good that I didn't have the BRCA1, BRCA2 gene, which, yes, that is great. So I brought up the RAD51D gene, and she said that they don't really worry about those small variations. She said, you know how you have a gene for your hair color and for your eye color? Well, sometimes those variations switch up, so then you have a different eye color or you have a different hair color. So she said that it is something similar to that. She said some of them turn out to be normal variations, and the Invitae, where I got the genetic testing done, she said that they will continue to track it, and if they get more information, because like I said before, they don't really know how it can affect your health now or in the future. So as they're tracking it, if more information comes about, then they'll make sure to go ahead and let me know. We talked about my appointment with the plastic surgeon, Dr. Kim, just, gave her a little brief overview of that. So that was quick because she had already spoken to him as well. And then I started in with my list of questions. So let's get into that. I asked her, if the cancer comes back, will it come back stronger? And then I asked her, is it going to come back in the same place or somewhere else? Which nobody knows where cancer goes and where it chooses to show up. She said that if the cancer stayed confined to the milk ducts and did not grow outside of that, and they removed all of the breast tissue, then the cancer should not come back in my lifetime. So I was like, oh my God, that's great. There is, however, a 4 to 10% chance that it could come back somewhere else, like in my skin or somewhere else. But that's a small percentage. And that's 4 to 10% in my lifetime. If the cancer did grow outside of the milk ducts from the time I got the biopsy to the time that I have the surgery, then that's the type of cancer that they worry about, because it becomes invasive cancer. So it could spread to a lymph node or something else or somewhere else. So what we're hoping for is that it stayed confined in the milk ducts. I learned today, after watching another woman's YouTube video, you should look at your lab results, because if it says that you have comedonecrosis, then that means that there's a higher chance that this DCIS will become an invasive cancer. So, I had to go look at my results, and guess what I found? I found that it said central expansive comedonecrosis present. Let me tell you, central expansive comedonecrosis is a type of breast cancer where dead and dying cells fill the breast duct and appear in the center of a tumor, okay? Now, it says it is often associated with high-grade ductal carcinoma in situ, all right, and a higher risk of developing invasive breast cancer. When I looked at my results and saw that the nuclei was 30%, and I looked that up, then that's what made me say, okay, this is an aggressive cancer. I figured that it was a more aggressive cancer based off my research, but I did not look up this actual term. So it's not separate from the stage. Like, it's still stage 0. It's just saying that it is a more aggressive form of this cancer that I have, and that if left untreated, then there is a higher possibility that it will return. It also goes on to say that the cancer cells are growing more rapidly and that there's a higher potential for local recurrence. That makes me feel even more better about my decision to just remove the breast tissue, because I just don't have time for that. I asked about breast conserving surgery and if I decided to keep the breast and just remove the piece of cancer, then, what would happen with that? And she said, because I was like, am I going to catch it early enough next time? And she basically said that if I left breast tissue, then I would be under a microscope and that they would be doing 3D mammograms every single time, like once a year. I would do a mammogram 6 months after the surgery and then a year thereafter if I chose to keep breast tissue, so that they could closely monitor it and make sure that nothing else is happening. Gregory asked how it could get through the milk duct, and basically it just grows. So we don't know what it's been doing since the biopsy to today. And, we don't know what it's going to do until I have the actual surgery. So it could be in there going crazy, which hopefully it's not. She said that in between the time of the biopsy and the time of the surgery, it could have very well grown outside of the milk ducts, but they won't know until they go in there and then take it out and send it off to pathology. She said for some women, it never leaves the milk ducts, but for some women, it does. It, has the potential to become an invasive cancer. Then it's important to make a decision and act on the decision as soon as possible. I talked to her about radiation and my findings, and basically everything is true. Like, you can have discolored breasts, it can, scar, blister, all those things are true. It's because when the radiation hits the breast, then it's affecting the blood supply. So then your breast will look different and other things could happen. So all of that's true. I asked her how long radiation would be, and she went on to say that there's a 20% chance that it is an invasive cancer. And if that's the case, then I might need to do chemo, radiation, and hormone therapy. I would probably do it for about 5 to 7 weeks. She said that they're trying to lessen the time for that. So if I wanted to, I can meet with the radiologist about that. But for me right now, I don't think that that's something that I need to do because I plan on just removing the breast tissue. Gregory brought up a good point about my Graves' disease and the radiation, because it's kind of like in alignment. So I asked her about that and what effects it would have on that. She said that they used to use radiation to treat Graves' disease, so nothing should happen with that if I did decide to do the radiation. We talked about hormone therapy and if I still needed to do that. My main concern was that I would have to take this hormone called tamoxifen, where people were having really, really bad side effects. And that kind of scared me. So I wanted to know a little bit more about that. But she said that if everything stayed in the milk ducts when they removed it, nothing went out anywhere, then I am done. I don't have to do any hormone therapy or anything. So I was like, okay, cool. Because she said that in DCIS, the hormone blockers are used to prevent the cancer from returning to breast tissue. So if I have a full mastectomy, then there is no breast tissue for it to return to. I asked her, is there another type of hormone therapy that I could take if I had to take hormone therapy? And she said, since I'm still having periods, then that's the only medication that I can take. So if I wanted to open up the doors to these other medications, then I could possibly be put into menopause early so that I can have, so that I can have a choice of different medications that aren't as crazy as this tamoxifen. She also said I could wait to go into menopause. So I don't necessarily need to be put into menopause. I could either wait or I could be put into menopause so that I have the option to take other medications. I saw a lot of women talking about how they had to do physical therapy. So I asked her, about physical therapy. Am I going to need to do that? She said, basically that depends on me and how I heal and stuff. But if I do need a physical therapist, to help me move my arms or, whatever is going on, then I can go ahead and go get one. I also asked her, how long do I have to safely make a decision? And she said that since we don't know what's going on in there, then I should make a decision as soon as possible. So I should not just be waiting around and doing that, because it could just be going crazy in there, like I said. I asked her if I'll lose sensation in my breast, and she said, probably. But if I do, then I'll get that sensation back. But if they try to keep the nipple, then the nipple's just going to be numb. So again, why would I keep that? I don't know. I don't know. They're working on new technology where they can reattach some nerves, so then you can still have that, feeling in your nipples. She talked about her concerns again about saving the nipple and about the scar tissue that's around there. She cannot guarantee that they'll be able to save it. And if it dies off, then they're going to need to go back in there and cut it off anyways. She went into, if I don't save the nipples, then I can have them tattooed on, the nipple reconstruction. There's also nipple prosthetics that I could get if I just really want to put some nipples on. I could plop them on there real quick with some adhesive. And she ultimately just said, if your main concern is your nipples, then maybe you want to consider getting the lumpectomy, just getting the breast conserving surgery. If you're so concerned about this, then that may be the option that you want to go. But I have other concerns with that breast conserving surgery, that I feel like the nipples over here are so minimal that I probably just need to just let that idea of saving them go. Gregory asked if we should just watch and wait, because again, it seems like it's just like a little bit of cancer. So can we just watch it closely and just see if it does something? Should we just wait it out before having to make such a grand decision? And she said that she does not suggest doing that. There was a trial that they did, and the first 3 years looked good, but they don't have any more information after that. So she was like, we don't know what's going to happen with that. Oh. Then we talked about the incisions, and she drew me some diagrams. All right, so these are some cuts I could have. So this one right here, that's the vertical, right? Just straight up, boom. That's the one that I would prefer if I had to have the nipple gone, which I think I'm just going to have them take the nips. All right, this one right here goes straight across. That's the horizontal one that I really just don't care too much for. This one, she said that she would either go with, one of these. These are just other options that she talked about. So she said they could start down here. This is the one I talked to the plastic surgeon about. They can start down there. If the nipple is fine, then okay, then they'll keep the nipple. If not, then they'll have to make another incision up and then grab that nipple and take that nipple out. So then I'll have a scar there and a scar there. This is the bat wing that the plastic surgeon talked about. So they'll go from the side up and around the nipple and then over here to save the nipple. And that's that. And then, yeah, I think that's it. I just talked about all these. I think I talked about all these. That's pretty much what it is. She said that she would not tell the plastic surgeon where to make the incisions, that she would just default to him on that, because, he's been doing this for a long time. So a certain cut may look different on somebody else. If you want them to be lifted or rounded or whatever, then he's like, okay, we need to do this cut to make them look as best as they can. So I was like, well, I just might need to just throw my hands up to that. And they know what my preferences are. If that is something that they can do, because basically right now I'm just like, let me just do the vertical up. Take the nips, do the vertical up. Let's call it a day. Hopefully they can do that. If you can't, then it'll just be that, because it seems like everybody can just do this. So I just don't want that. I asked her what she would do. She said that she would just have them take everything, including the nipples, have herself some perky little titties, and just call it a day. She said at this stage in the game, like how old she is now, that she is not that concerned about the mound, so she would just go flat. She wanted to be clear about the procedure that I would be getting. All right. She said that it's a total mastectomy. And on the left side, it's a contralateral prophylactic mastectomy. That's basically where the healthy breast tissue is removed in addition to the cancerous breast tissue. On the order, she put skin sparing or nipple sparing, just so that she could give me the time to make the decision on whether or not I want to try to save the nipples or not. And then she went back and said that they're both concerned about the nipple because of the scarring and stuff, and she does not know about what the blood circulation is going to be there. Again, they'll check it with the anesthesiologist with the dye prior to, but they're just concerned that even, you know, after that, it may or may not work. And then even in my research, like, I haven't really found anything super great about saving nipples. So, I mean, I'll just be nippleless. Just be nippleless. I don't know, shoot. I'll go get some nipples made real quick. Oh man, there's so many different nipple options. Then she told me about some new stuff called a fibroid lymph node. So she said if they go in there, send it off to pathology, find out it was an invasive cancer, then I may need to go back to get a sentinel lymph node biopsy. This will be a separate operation. So she gave me the option to just do it, to remove the lymph node while I'm already under. This procedure adds a half an hour to the existing procedure. If I do go ahead and do that, then it puts me at risk for numbing and swelling of the arm. Now, it's only a 3% chance, but she was saying that my arm could just be numb, or a part of my arm could be numb forever, or, you know, the numbness could come back. I could also have swelling of the arm. So I said, is this a noticeable swelling of the arm, or what is this? She said it could be noticeable. So as I'm going through life and stuff and I'm figuring out what triggers the swelling, then I would want to put on a compressed sleeve prior to doing that. So like if I'm about to go flying and I know that flying makes my arm swell up, well, before I go fly, then I better put on my sleeve compress, because I don't want my arm to become noticeably bigger than the other arm. So I was like, at first I was like, okay, cool. Like, just go ahead and do that, because I don't want to have to worry about coming back. But then I was just like, you know what? I would probably be that 3% person where their arm is numb and just swells up. And I just was like, I'm just going to hold off on that and see what pathology says. I immediately thought of the nutty professor when she was telling me this story. I was like, oh my gosh, I'm too scared for that. I am too scared. And she said the swelling could happen years down the road. So it's like, we don't know when this swelling could appear. We don't know. We don't know. She said anytime that they remove the lymph nodes under your arm, then you are at risk for swelling. So they try to remove as little number of lymph nodes as possible because of that. She said surgery is about a month out. So I'm thinking maybe the end of this month, beginning of March, then I'll probably be scheduled to have the surgery. It's going to be at the main campus, at the Loma Linda campus, because that's where the plastic surgeons operate. So I have to go there for the surgery. She put in prescriptions for me to go pick up so that I have them prior to the surgery. So I need to make sure that they updated my pharmacy so that I can go ahead and go pick those up, because I don't want to wait until the last minute for that. That'd be crazy. She prescribed tramadol, a muscle relaxer, celecoxib, which is a anti-inflammatory drug used to treat mild pain and relieve symptoms of arthritis. And then what else? She also prescribed a stool softener, celecoxib, which is a pain medication used to treat mild to moderate pain as well as symptoms of arthritis. I don't know if that's because I told her that I have arthritis in my knee, or is that just for pain, or is it for both? I don't know. When my doctor told me I had arthritis, he told me to just wear a knee brace. She also prescribed a stool softener and a nerve ending pain medication, which from the women that I have watched and listened to, that medication is crucial. They say that you will have nerve pain for like a year. Like some women have had nerve pain for like a year or more. So I would imagine that would be a crucial medication. She said that they'll put the leg squeezers on when I'm in surgery. When I had my gallbladder removed last year, then they gave me a pair. So I am going to bring that pair with me to the hospital. So when I get discharged, when I'm in the car, I'll just put those things on and just have them just going. She said that it's not necessary for me to do that because I should be up walking around by then, but I don't want to risk getting a blood clot. I just don't want to do that. So I'm gonna just do everything in my power to not get a blood clot. And if it's those things on my legs, and that's just what I'm gonna wear. I had to wear those for like a week when I got my gallbladder removed, at night and in the day. So I may just do that for a week. Lastly, I asked her about getting my tubes tied, and she told me that I need to work with Dr. Kim on that, the plastic surgeon, because he's going to want me to get healed up off of all of this stuff before I go off doing some other stuff. So I'm just going to put that on the back burner for right now. Nothing is happening with me with that. So that's not something that's, in the front line that I need to take care of anytime soon. So I'll just wait on that. But yeah, that was a lot of information in that appointment as well. I am just hoping that this cancer has stayed in the milk ducts and did not grow outside of it, because I just don't want to have to do anything extra. But I mean, shoot, we all want to and don't want to do certain things, and life just happens. So I'm just hoping that for me, they just take everything and then I am done. So yeah, that's what happened there. I'll let you guys know when I have a surgery date, and then I may be popping up with other little videos of things that I've learned. I do have an unboxing video that I'm going to be posting showing what kind of things that I got so far. There are still things that I need to get, like the pajamas that unbutton down the front. I need to get the surgical bras. I need to get a walking pad. This one woman said that she loved having this walking pad because you're supposed to get up and move around and walk around and stuff. So she would just get up out of her bed, walk on the walking pad, which is basically like a treadmill that you can like put under your bed or fold up or whatever. She would get out of her bed, walk on her walking pad for her 10 minutes, and then just get back in there. So I am going to get a walking pad. I need a mastectomy pillow for the ride home. I haven't gotten that yet because at first I didn't know what I was going to do. I was like, am I going to do this breast conserving? Am I going to do this mastectomy? I think there's like a few more things, but I don't know. But those are the main things that I have left that I need to get. So yeah, I'll be working on that, working on getting that. And then yeah, that's about it. I mean, shoot, I'm just trucking along over here. So everything so far so good. So yeah, we'll see you guys in the next video. Bye-bye. I can't even get out right now. Oh my God. Okay, let's try it again. I'm too close. Bye. Okay. I'm looking at my notes like, what I put? Comedo, is it comedo? Comedo necrosis. Comedo necrosis. Let me see. Pronunciation. Comedo necrosis. Comedo necrosis. I asked about breast. What is that? Okay. Girl, what is this? I just said it too, I thought. I'll try to even say it right. Pronunciation. Celecoxib. Okay.